And when you come and see Laura Lee, you can learn new words like stratocorneum. Do you know how to spell that? Recently, I was introduced to a new peel. It's called an Infusion Peel. No downtime. Perfect. We're gonna meet with Laura Lee, the expert, and she's gonna guide us through how it works and why it's the fastest and apparently the most comprehensive peel that I can get. If you have watched my channel before, you know who this is. Laura Lee, she is a registered nurse and I've called her my skin guru a time or two. Hey!
Hey, good to see you.
Oh, thank you for letting us come back into your office.
I'm excited to share this with you.
Tell me why it's different from most peels.
You're gonna get 2 procedures in one treatment. So not only are you going to get a microdermabrasion with a aluminum oxide tip versus a crystal tip, but after that you'll also get an infusion of either peptides, lactic acid, antioxidant moisturizing serum, and even for those who have brown spot issues, I could do a lightening serum. So it's very customizable.
Okay, so you mentioned the microdermabrasion and you talk about the difference in the tip that you're using. What does that mean and why is that good?
The aluminum oxide tip is a little less abrasive, and it's really the standard for microdermabrasion now versus a crystal tip, which can cause little micro injuries in the skin.
What are the perks?
What's wonderful about this peel is that you have immediate results when you walk out. You immediately, if you feel your skin, it'll feel softer, it'll have a glow about it. Just an overall nice look to the skin, glow to the skin.
So that kind of instant gratification
instant,
that we're
yes.
looking for. Oh, I like that. So today we're going to walk you through the process from the microderm to the actual infusion, and we're going to talk about any potential aftercare and how to make the results last as long as they possibly can. And I will tell you, one of the things I love is that it doesn't hurt. I mean, have you had anyone complain about any pain?
No pain, no pain.
Okay, so win. All cleaned off, well, for the most part. Getting cleansed, and so now, Laura Lee, what's next?
We're going to start the first step in the infusion peel, and that's to cleanse again, and I'm going to be using glycolic acid that's in the serum.
Okay, so I hear the word acid and it sounds scary, but what does it do?
It's an alpha hydroxy, it's a sugar acid, and it's going to go down into your pores and almost work like a solvent to unglue or unstick the dead skin cells, any extra sebum that I wasn't able to get with my manual cleansing.
Okay, let's go for it. Now, how often can you get the infusion peel?
The manufacturer says you can do this as often as every 2 weeks, but I recommend about every 4 to 6 weeks for most of my patients. It's a nice peel to do right before a big event though. You could do it a couple days before, since you do get such immediate results without any downtime.
So what are you doing right now?
Right now there's a little vacuum, slightly vacuuming up the pores, cleaning out any debris that was left behind from my manual cleaning. And it's using glycolic acid and some other ingredients like a witch hazel and aloe to gently clean out the pores so that we get every last bit of oil and sebum, makeup, and just all the things our face accrues throughout the day.
What age would you recommend, or can anyone get this?
Anybody can get this peel. You do want to be a little cautious with anybody that has any rosacea, only because of the vacuum, but as you can feel, it's very light.
No,
It's not like a big sucking on the skin at all. It's a light vacuum, kind of lifting up the skin and then infusing some of the glycolic to get down in there and clean out the pores. A lot of my patients find it very relaxing.
I was definitely relaxed, especially when I wasn't trying to shoot a YouTube video.
Yes.
You're going to be doing the peptides, correct?
I am. I'm going to choose peptides for you. That's going to help renew your skin cells, build collagen and elastin. What's really special about this peel is that you get an infusion of these wonderful ingredients after we do the microdermabrasion. Now I'm going to put on the aluminum oxide tip.
Okay, show me how that, yeah, there we go.
And I'm going to use the gentle one for you. I'm going to set the settings for your skin. I start on the forehead, and you can just feel it kind of vacuum. And what it's doing is it's lifting up that skin, that vacuum is, so that I can get a nice microdermabrasion with this tip. And you feel that? It's not painful or anything. And I've had patients almost fall asleep. They think it's very relaxing.
Yeah, it just feels like a little bit of pressure. And I can feel the suction. I can hear it more than I can feel it.
So right now, I'm working on the epidermis. I'm getting that top layer, that stratum corneum, exfoliating that top layer. Peptides are great anti-agers now.
And we're losing collagen the older we get, so we really want
to build that up.
Now, can you work out after having this done, or because you're putting the infusion, would you avoid it?
You could, but I tell my patients on the day you get your peel, a lot of patients will work out before they come in, to just enjoy the peel and not really get real sweaty the day of any of the peels that we do. I always like to include the neck. Our skin doesn't stop at our chin line.
Why get a peel for people who are kind of like, I like my skincare, I'm good. What's the upside? What's the reason?
Well, kind of like if you eat well at home, but you don't work out at all, you're not getting the full benefit that you can get for your body. If you use your products at home and you think, well, I don't need to go get a peel, you're missing a good part of skin health and skin care.
And when you come and see Laura Lee, you can learn new words like stratocorneum. Do you know how to spell that?
Yes, I do. I will help you. All right, so now I'm going to get ready to do the infusion of the peptides.
And you can see I'm not really red. I don't see much. What do you think?
No.
Pretty good. Okay, maybe just a little bit, but we just got done. Peptide me up. And this just feels kind of like cooling.
And you can see a little bit of the serum.
I hear it more than I feel it. I swear I'd be in trouble if I worked here because I feel like someone would open the door and I'd just have this skin thing. Oh, sorry, yeah, next patient. Now, post-care.
I usually tell my patients after any procedure they have done here, don't use your Retin-A or your tretinoin or your vitamin A that evening. Just because we've really gotten that outer layer of dead skin off, and it can make you a little hypersensitive.
So are we done?
Almost.
Okay.
I'm going to put a few serums on your skin, one of which is the vitamin C that we were talking about. And it might tingle a little bit because we've really cleaned out those pores. And we want this vitamin C to soak down in there. So I'm just going to massage some vitamin C into your skin, then a moisturizer, and then a sunscreen.
Okay.
That is the infusion peel.
So I commented to Laura Lee that when I get home and I look in the mirror, I feel like my pores look smaller, and she just blew my mind. You cannot shrink a pore?
Truly, it's a misnomer when something says it shrinks pores. What it can really do is clean out the pores, make them appear smaller. But to truly take a pore and shrink it close together, it's not really going to happen. Now, you can make it look better. You can use alpha hydroxys, you can use beta hydroxys, you can have procedures done, and definitely your pores will look better, they will look smaller, but like a doctor once told me, if you really have a large pore and you want it to be small, you'd have to sew it shut.
Whoa, okay, that clarifies so much. But either way, they're cleaned out, they look good.
You can definitely go from somebody who looks like their pores are enlarged and clogged to looking like, wow, your pores are smaller. And they will appear smaller because it's been cleaned out. The whole shrinking a pore,
don't buy it. Well, it looks great. So Infusion Peel.
great.
Sign me up. Or, well, we already did. Thanks, Laura Lee.
You're welcome. Thank you, Kara.